Hello, everyone. It's Matt Perrin back with you here from Carallel, Director of Caregiver Engagement. And we're here today for the August edition. I can't believe it's August, but the August edition of our Caregiver Conversation series. And today we're going to be talking about the financial strain of caregiving and what we can do about it. So I am really lucky to be joined today by my colleague, Stephanie Banta. Hey, Stephanie.
Hey, Matt. Hey, everybody. Glad to be here.
Well, we're glad you're here. Thanks for joining us. I think Stephanie's probably a familiar face to attendees today, but for anybody that's seeing her face for the first time, Stephanie's a care advocate here at Carallel, and we're thrilled to have her joining us today. Quick housekeeping per usual. First and foremost, if you're joining one of these sessions for the first time, welcome. Glad you're here. Carallel is a caregiver support company. We support, guide, and assist family caregivers through whatever it is that's on their plate. And we do that in two ways, with our support line, where we provide, our care advocates like Stephanie provide personalized one-on-one support for people who are caring for a loved one. And we complement that one-on-one personalized support with our digital experience called My Care Desk. So we make the service available through health plans and employers across the country. If you're not sure whether or not you have access, ask your employer or ask your health plan. Second, really important piece of housekeeping is these are conversations by design. It's intentional use of that word. So as Stephanie and I are talking about today's topic, if there are questions, perspectives that you want to share, please do share them in the chat. We'll do our best to respond live. And in situations where we don't, we will respond after this session. And lastly, we have a handout today. It's a list of reference links. We're going to be mentioning some services that we found helpful, and the links to those services can be found on the reference list in the handout section. You should see a handout section in the console of your GoToWebinar, and you should be able to click on it and download. If you have issues, just respond to your webinar registration email. Any email you got for this session from GoToWebinar, that comes directly to me, and I'll make sure you get the reference list. So that's a mouthful. Stephanie, did I miss any of our housekeeping?
I don't think so. I think we're good.
Okay. So let's dive in, because time flies when we're having fun, as we all know. The focus today, as Stephanie and I were preparing, as we normally do, we're really focused on the practical aspects of this topic. So today, that means a couple of things. Number one, stepping back briefly, and just to sort of take in the context of the financial strain that can come with caring for a loved one. We're not going to belabor it, because if you're in it, you know all about it. But it is helpful to realize we're not alone. And more importantly, we're going to talk about little things we can be doing that add up to we hope make a meaningful impact anyway on making caregiving more affordable. And so with that, to set some context, Stephanie, I really like this Merrill Lynch Age Wave report. It's from a couple of years ago, but I just, when I was in the midst of my caregiving with my mom, the financial aspect was a constant strain. But at times, like so much about caregiving, I kind of felt like I was the only one, right, who was like feeling that weight. So some interesting data points just to orient us here. And this study was based on a survey of 2,000 family caregivers. So the report talks about two primary roles, right? There's the financial coordinator, so you're paying the bills, you're keeping track of the finances. But then there's the financial provider, where you actually, you're dipping into your pocket for these costs. And interestingly, 64%, so significantly over half of the caregivers surveyed are filling both of those roles. It's a ton to have on somebody's plate, in addition to our day-to-day work as just keeping our loved ones safe, in good health, with purpose, etc. So, and then also interesting, Stephanie, how much, if you had to guess, how much do you think would the family caregivers on average spend for the care of their loved one?
It's definitely in the thousands.
Yeah, per year. Yeah, $7,000 per year on average. Some obviously less, many much more. So it's just that number, more than anything else, was really eye-popping for me. So let's get to sort of the little things that we can be doing to chip away at the financial strain that we feel caring for somebody we love. So the first, I think of it, Stephanie, in a couple of buckets. Well, really 3 buckets if I want to get particular, but saving money, obviously, bringing in money, which is kind of an elephant in the room topic when it comes to caregiving. We'll talk about that. But then also there's this third bucket. It's really all about connecting to services, ideally local, that can help us, right? Do either of those 2 things, save money or bring money in. So that's sort of how we'll structure the conversation today. Sound good?
Sounds good.
All right. And again, any questions from the audience, perspectives to share, thoughts, please do share them in the chat. I'll be keeping an eye on that. So Stephanie, let's talk about saving money first. What do we have for tips there? What about prescriptions? Seems like it could be an obvious one for us to look to get some savings.
Absolutely. And so there are a number of things that we can suggest. For most people caring for a loved one, medication expenses are a big part of the expenses of caregiving. Ask your loved one's doctor for free samples. Ask the doctor about switching to a lower cost generic version of a drug if that's possible. You can also talk with their pharmacist about that. And then we have some additional programs that can help you. They're linked in our resources. One is something called Extra Help with Medicare Prescription Drug Plan Costs. Long name, but it's actually part of the Medicare program for people who qualify. This can get you additional assistance. It can be worth up to $5,100 per year for Medicare recipients who are struggling with these costs. Second kind of resource is a medicine assistance tool website that we've got. That connects you with all of the resources offered by the biopharmaceutical industry. So many manufacturers have programs to help people who are struggling to deal with medication costs. And you can look up the medication there and see if the manufacturer has a program like that. You can also, of course, go directly to the manufacturer's website. Third, we have a list of discount pharmacies, GoodRx, FamilyWise, Prescription Hope. These are all providers that can save you significantly on the cost of prescriptions. So it's always a good deal or a good idea to check and see what the price is on some of these sites. And finally, we have come up with a couple of charitable foundations that have funding to help people with healthcare costs under certain circumstances. So HealthWell Foundation and PAN Foundation are those 2 resources. So it is worth going through those to see if you and your loved one might qualify for any of those kinds of help. And of course, the discount pharmacies, everybody qualifies. It's just another provider that you can check with.
Thanks for those resources, Stephanie. And you mentioned the pharmacists. So I got a piece of advice when I was in kind of the earlier years, maybe the 3rd or 4th inning, let's say, of my caregiving. But this piece of advice was build relationships, which at the time I heard it made my eyes roll back in my head because I was at my wit's end and stressed. But it turned out actually to be really helpful advice, and all it was meant was just you never know where help is going to come from, right? So for me, one of the easiest people to build a relationship with was my mother's pharmacist. Initially, at that time, I was still going to CVS to do her prescriptions, and it felt like I was there every week, and it was always the same man. It just very, very helpful, and it was that relationship. He almost became an outlet for me to just talk, and like there's some social interaction, but more than that, he kind of pointed me to certain resources that could help my mom at that stage save some money on her medications, because your point is taken so expensive. So I just wanted to mention that just build relationships, recurring theme that we talk about on all of these sessions, but wanted to mention that anecdote. And secondly, on medications, Stephanie, sorry, we had a November session. If you go on Carallel's website, under caregiver resources, you'll find the caregiver conversations page. We have all the replays there for the last year. November session was on that topic specifically, medication management, and we spent a lot of time talking about ways to save money on prescription. And I'm sorry, I rudely stepped over you there, Stephanie.
No, I interrupted you. I just wanted to say some pharmacies also have 1 or more days per month when seniors get extra discounts. So if you're buying over-the-counter stuff or supplies, see if the local pharmacy has a day like that if you're purchasing them for a senior, and you can buy ahead and buy on a day when there's an extra discount.
Awesome. Thanks for that tip. Okay, so the next sort of category of things on which we might be able to save some money, medical equipment. So I'm thinking about, walkers, canes, wheelchairs, shower chairs in some cases, the stuff we need to keep a certain quality of life for our loved one, keep them safe, etc. Right? And this is another area where we can, we can at least ask and inquire and see what's possible in terms of saving some money. Can the doctor prescribe it? Is sort of one sort of really basic question. But again, we don't, when we're in the caregiving weeds, we're not always thinking about or seeing what might be obvious, right? In moments that we're a little bit calmer. So asking if the doctor can prescribe. I'm also a huge fan of lending closets. I don't know about you, Stephanie, but just I just got so much value out of the local lending closet. Two, actually, one at the hospital where my mom lived, but also there was a church lending closet at my mom's church. So I just got a ton of value out of those. Key point, and I know, Stephanie, I've heard you say this before, is if we're using a lending closet, whatever piece of equipment we're getting from the lending closet, making sure that we're getting help, ensuring proper fit, and that we know how to use it, right?
Yeah, typically lending closets will do that. They'll make sure the item is not broken, it's working properly, but certainly it's a good thing to double check. And if you're getting something from a friend or acquaintance, you want to test it, make sure that it's working properly, it'll hold the weight that it needs to hold, etc. Just to be sure that you're being safe.
Okay. I'm seeing some. So I'm getting a couple of questions here. So yes, I can. We can provide a reference list via email. So I'll make note of that. Oh, okay. It looks like people are having success with the handout, so that's great. And so Stephanie, somebody, a viewer made the comment, the PAN Foundation is what is covering my husband's prostate cancer. They're very helpful.
So glad. I'm very glad that you have gotten help in that way. Sometimes it can be hard to even learn about or find out about these resources. So I'm glad you're getting help from them.
Okay, and then one more comment. These are great comments. Thank you, everybody. I found out if you group the medicine together with the pharmacy, you don't have to go all the time if the pharmacy does it, and you have to talk with them and the doctor. Right, good point. Yeah, bulking. I, for some reason, never got, I was always playing catch up with my mom's medications, but it's a really, really good point. And, just in general, any little thing, it's a great example of like little things that we can be doing that add up, right? Just as we're talking about here today in the context of making caregiving more affordable. Okay, so Stephanie, let's, I know you had a couple other comments on ways to save money.
Yeah. So just a quick comment, saving money in one area of the budget gives you an extra dollar to use somewhere else. So, for example, if your loved one qualifies for Meals on Wheels, that may reduce their food costs. If they qualify for help with utility bills, often utility companies or your city or county Department of Aging will know about those programs. If you can save money in those areas, that may free up a few bucks that you can use in whatever the area of stress is, if that's medical costs. So think
Yeah,
about those things.
no, it's a great point. There's, my, one of my mom's favorite sayings was, life is all about trade-offs. I'm sure it wasn't her original, but I can just hear her New England, Massachusetts accent in my ears, still telling me about that. So, but you're absolutely right. One other thought, Stephanie, that popped into my head as you were talking there is, um, this is a big topic, right? I mean,
Yeah.
we all know it's not news to anyone how expensive it can be to care for a loved one in the face of, um, life-altering or limiting illness, aging, disability, injury, and there are different kinds of expenses, right? Like one of the audience members mentioning their husband's cancer care, just huge expense. Prescriptions on a monthly basis, a little different order of magnitude there. But in general, this common, what's becoming a common thread of just always asking, building relationships where we can, and sort of the sum of the parts is really really pretty important here. So, and speaking of sort of bigger expenses, home modifications. That was another tip we wanted to talk about, right?
Yep.
Whether it be adding a ramp to the front of someone's house so that your loved one can get in and out easier, or actually renovating the inside of the structure to make it more open, reduce fall risk, add a bedroom or a bathroom, what have you, right down to adding grab bars in the bathroom. So there's all sorts of various levels of home modifications, and it can all be expensive. Obviously, renovating your home is a gigantic expense that not a lot of us have extra budget laying around for. So
Yeah.
there are some services worth checking into to see, the Older Americans Act for one. So it might be helpful to go to your local area agency on aging, or calling them and asking for information on the Older Americans Act, which at times does subsidize bits and pieces of home modification costs or costs related to it. Checking with your city or town housing department is another, Stephanie, where
Yep.
again, worth asking the question. And then in long-term care insurance, I wish my mom had it. She didn't. A lot of people do, but it's worth looking into that policy if your loved one does have a policy, to see what, if any, funds they can allocate towards home modifications. Anything I'm missing there, Stephanie?
Nope.
Okay.
You got it.
Yeah, and then the comments are coming. Geez, okay. Yes, we can. If you're having trouble with the handouts, I will share it after. Okay. Okay. Oh, it looks like they got the handout. So looking at the clock, bringing in money, we need to talk about,
Yep.
Stephanie, and the elephant in the room question is, can we get paid for the care work that we're
Yep.
providing? And the short answer is maybe a little bit in some places, kind of, right? I wish I had a better answer for you, but that's the scenario. Most of these, there are a couple of, we'll talk about veterans benefits and a federal program at that level, but most of the programs available are state driven, and Medicaid related, right? So some examples. And when they're state driven, they have specific eligibility requirements based on the state that you're in. But for Medicaid recipients, some examples could be home and community-based services, community first choice option, home and community-based service waivers, self-directed personal assistance services. There are a number of services. They have different names. Many of them are similar. but it's worth checking out if you are a Medicaid recipient, your state's Medicaid website. Did you have a comment
Yeah.
there, Stephanie?
Yeah, I would say this is one of the most common questions we get from caregivers. So it is important. I would
Yeah.
say don't get down in the weeds about the name of the program. The point of this is Medicaid, as you know, is a federal program, but it's administered by the states. And that means that there are slight differences, sometimes bigger differences in every state about what the programs are, what they're called, how you qualify. The point is that all of the kinds of names that Matt was talking about, the idea here is that Medicaid realizes that most people want to stay in their homes or living with a loved one, and it can be much cheaper um, to have someone cared by a loved one than to have them in a care facility. So that's why they have these various programs. They are mostly for people already on Medicaid, but programs that can pay a family member.
Mm-hmm.
So the article that we have in the resources will kind of walk you through, and it even has a link to information state by state. So you can get started and see if your loved one might qualify and what might be available in your state or their state if it's a different one. Did we
Excellent
want to
stuff.
talk about veterans benefits then too?
Yeah, I was just, you read my mind. I was going to ask you about veterans
Okay.
benefits.
Veterans benefits are kind of similar in that there are several different names of programs and slightly different ways to qualify. They're called aid and attendance benefits, housebound benefits, comprehensive assistance for family caregivers. Again, these are all programs to pay a family member to care for a military veteran who has these care needs. And the best way to find out if you have a loved one who's a military veteran, the best way to find out about these programs is to go to caregiver.va.gov. And I'm sorry, that one didn't quite make its way into our list of resources, so I'll say it again, you can jot it down. Caregiver.va.gov will get you to the place in the Veterans Administration that will help you with these payment for family caregiver programs and lots of other support for family caregivers offered through the VA.
And I just put that that URL because it didn't make it into
Perfect.
our resource links list. I put it in the chat, so everyone should see it. If you see chat in your console, you can just go ahead and click on that link. Thanks for that, Stephanie. I appreciate you sort of rounding out both the veterans benefits, but also just in general, sort of the key message on whether or not we can get compensated for the care work that we're providing.
Yep.
So,
and it doesn't necessarily have to be an elder person. It could be a person with disabilities.
Yeah,
So,
great
of
call
any
out.
age.
Great call out. And then the other, so on that note though, I just mentioned a couple of minutes ago, long-term care insurance. That is, again, if your loved one does have a policy, a potential source of compensation. Not all plans offer it, but it's worth checking the policy to see whether or not your loved one's does.
Yep. I've got two others I want to mention really quickly. One is
okay.
a company paid leave program. Most paid caregiver leave programs are unpaid, but it's worth asking your employer if they have a paid family leave policy. And finally, it may work to look into families funding the care. Sometimes an extended family will pay one family member to care for the loved one who needs that care. It can be a ticklish thing to bring up, but if you're the one providing the hands-on care and you're also paying out of pocket, it could be worth talking with other family members. They may have no idea how much you're shelling out, and if they don't live in the area and can't do the hands-on stuff, can they pick up some of these costs at least? It's worth opening the conversation, perhaps.
Yep. Yep. Definitely can be a tricky conversation, but absolutely worth it. And we've talked about that in other contexts before, just around sort of thinking about family meetings as a tool and how to effectively, how to have effective caregiving related conversation. So there's you'll find on Carallel.com some that's a common thread topic through many of the past sessions we've done here. So I think so there's a question on veterans benefits. Stephanie, you may or may not have an answer. I don't have the answer off the top of my head, but when it comes to veterans benefits, does your loved one have to be the veteran, or can it be a relative who's deceased?
So the person receiving the benefits typically is the military veteran themselves, but there are some benefits for military spouses. So the spouse who may be deceased was the veteran. So it is totally worth going to that VA website to find out. Was that what you were asking? Yeah.
.gov. I think so, but I'll be sure to follow up with the question asker.
They do have a hotline that you can call as well.
Okay. Okay, so taxes is another way, sort of separate bucket, but can we have 3 minutes, definitely want to talk about taxes.
Okay. There are several kinds of tax breaks. The child tax credit was expanded in 2017. It can include relatives other than a child. It could include parents. That is a tax credit, which means it directly reduces the amount you pay in taxes, which is the most valuable kind of tax break. Under certain circumstances, you can deduct a dependent's medical expenses. That dependent could be a parent, and they you have to, your medical expenses in total for you and your dependents has to be at least 7.5% of your adjusted gross income, but that could work. There is then something called a child and dependent care credit, different one than the one I mentioned a minute ago. This is you claiming a portion of your caregiving costs if you have to hire someone to care for a person who has care needs, adult daycare, child care, home health worker. And we've got some links to the IRS in our handouts, so you can go and get more information about these programs and see if you qualify. Finally, I'd say if your employer has a flex spending or a health savings account, it may cover expenses for a loved one you're caring for. So do ask about that. And in all these cases, it's important to keep your receipts for your caregiving related expenses.
Yes. And that's great information, Stephanie, and you did it in 2 minutes, which is awesome. I wanted to call out that on the resource link list that we have in the handouts, there's a link to IRS free tax help, and a finder there, both of which are quite helpful. I actually I took advantage of the free tax help from the IRS. With my mom, and it was quite helpful. So there is
and the sooner the better.
Yeah, exactly.
Don't wait until April 14th.
Right. No, that's for sure. So there is a question: will we be covering independent living facilities, assisted living, etc.? Not on this call. We've had many sessions on those topics, and in some specifically on the financial considerations when thinking about assisted living, senior living, skilled nursing, etc. So I will follow up with the question asker directly with some information there. But great question. So
yeah, that's a whole topic of its own.
Yeah, it is. It is. Stephanie, time flies when we're having fun. I mean, 30 minutes went by in a blink. So are there any parting shots or thoughts?
Just know you're not alone. Yeah. We recognize that caregiving involves out the door expenditures. It also, for some people, involves having to cut back on their work hours or even leave a paid job. So there can be a real crunch. And we are here to try and help with all the resources we can find for you to at least relieve some of that financial stress of caregiving.
I agree. And I guess my final thought would be every little bit helps.
Yeah.
I know Stephanie says that often, my colleague Perry says it often, but and looking back now on my caregiving experience, I do believe it, and every little bit does help. It truly is a sum of the parts situation, and I wish there were a magic wand, but until we have one to make this easy and more affordable, every little bit does help. So hope you can join us for our September edition. That is on September 28th. I'll be talking, the topic will be thinking differently about the end of life. Very emotionally charged topic, but an important one. I'm looking forward to that conversation. Hope you can join us for that. September 28th, noon Eastern at the usual time. And of course, I will follow up with any question askers after the session. And thank you for being here.